Malaria, first and foremost, is the commonest parasitic infection that we have in India right now. So, malaria is caused by predominantly four species of Plasmodium parasite, primarily Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, and Plasmodium malariae. Of all these four, primarily in practice, we get Plasmodium vivax and Plasmodium falciparum the most. Malaria can be a problematic thing. We're still trying to eradicate it, but it's very difficult, and it's predominantly very much active in the northeast states of India. Malaria usually starts with a very high fever, and sometimes malaria after that, abdominal complications like tummy pain and nausea, vomiting. These can also be there. But primarily, what the way we differentiate fever associated with malaria from other fevers is the severe amount of rigor and chill, the shiverish thing that happens with malaria. And it's a very characteristic thing. And these things, whenever happens, it's better to consult a doctor and get blood work done. In practice, we use peripheral blood smear to detect the malarial parasite. That way, it's pretty much, it's pretty sensitive, and it has a it gives a very good idea. And malaria, otherwise, we have the new generation kits, the malaria rapid antigen rapid test kits, which uses the dipstick strategy to identify that. Malaria is a very organ-specific treatment. The underlying causative agent, which is usually it's a vector-borne disease, right? So it's a vector-borne disease, and it is spread through the female Anopheles mosquito. So if the underlying organism is Plasmodium vivax or Plasmodium ovale, we go with a treatment involving chloroquine and along with primaquine. Otherwise, if it's a falciparum or a malariae, then usually we believe in the use of artesunate therapy, antimalarial drugs. Artesunate is combined with other drugs like sulfur dioxide and artemether, or these kind of drugs are usually used, and that way malaria can be treated, and the outcome is very tolerable for the patient, I must say. First and foremost, one more thing I want to mention is malaria in a pregnant woman. The treatment is a little bit different. We don't use primaquine in cases of pregnant females who are suffering from malaria. And the complications per se, first and foremost, malaria overall can involve other systems of the body as well. It's primarily a complication of the bloodstream and everything, but other like shock, there are splenomegaly, spleen gets larger in size, and other complications like respiratory distress. These things can precipitate if and only if malaria is left untreated for a considerable amount of time or undiagnosed in that case. Fresh fruits and proper hydrations are the key when it comes to treatment with any kind of malaria or fever per se. But in practice, we advise patients to have fruits which have a lot of vitamin A and vitamin C, like papaya, beetroot, and any kind of citrus fruits like lemons. That they actually help and are very well tolerated by the malaria patients. A proper high protein diet, because malaria can take a huge toll on your body during the time that it stays there. So a proper high protein diet helps the patient fight this complication very well. If you are very spot on with the initiation of the treatment, as I earlier mentioned, and if you take proper good care of all the other systems of the body, and good monitoring is done, a malaria patient usually recovers within like 2 weeks time. The initial management and the upliftment of the symptoms that happens within like 5 to 7 days. But overall, we discharge the patient after that once the other symptoms are more or less subsided. And usually, a patient is back to its normal self by 2 weeks' time. Yeah. Post malaria syndrome, it's a very rare thing, but it's there. See, malaria, as I've mentioned, it takes a very big toll on your body. So after that, maybe in very few cases, we get some neurological symptoms as well. Patients have some neuropsychiatric issues, which subside on their own usually, but otherwise, grossly, if the during the phase of the infection and the treatment, if the other systems are properly coordinated and taken care of, then patients usually are not having much complicated post exposure symptoms. But this we have seen in few cases. This has to be dealt with utmost care, and if needed, proper psychiatric evaluation and neurological evaluation needs to be done. First and foremost, prevented by proper screening and eradication of any form of stagnant water bodies in and around your house. Malaria, the the parasite, it has two phases of its life. One in the human body, and the other in the body of the mosquito, where it grows and it gets the infected form. So if we remove the breeding places of mosquitoes, then that's going to help. And in endemic areas, it's very, very important to use mosquito nets. Malaria and dengue, the causative agents for both of the diseases are completely different. In case of malaria, it's a vector-borne disease from Plasmodium strains, while dengue is a viral disease, and dengue, the manifestations of dengue are also very different from malaria. In cases of dengue, a very drastic fall in platelet counts is very fast, and it can precipitate into some kind of dengue hemorrhagic fever, which is manifested with bleeding complications. While in malaria, it's more of a fever along with some kind of some issues with the abdominal organs. So, in that fashion, dengue and malaria are very different. Malaria can be avoided if proper care around the house by removal of water bodies, stagnant water bodies, and use of mosquito nets are implemented. Uh, and if you are having very high fever and very rigor and everything, then it's better to consult a doctor because malaria can, if not stopped early, can take a very bad toll on your body, and it is a very involving disease, and it's better to identify it very early with the help of a doctor and start on medication.